Srinath S, consultant physician, diabetologist at MS Ramya Hospital, Bangalore. So I'll talk about diabetes and COVID. So it's already 1.5 years into the pandemic, and we know how much of a problem both economically, socially, we have faced because of the COVID infection. So as we all know, COVID spreads through droplet infection. It's a droplet infection. It spreads basically through respiratory droplets. So somebody coughs, sneezes, or talks. That is how the virus transfers from one person to another person. Now, this infection can happen to any particular age and to anybody, irrespective of the gender, age, or comorbidities. However, there is certain population who are vulnerable to a serious COVID. So, who are these vulnerable populations? So pregnant ladies, or somebody who's diabetic, somebody who's having a cardiac issue, somebody who's kidney transplant recipient who's on immunosuppressant drugs, somebody who's having chronic connective tissue disorders, arthritis, who is on immunosuppressive drugs, or somebody who's a cancer patient who's receiving chemotherapy, whose immunity is compromised. So we all know that diabetes is also an immunocompromised state, meaning that patient's immunity is not up to the mark. So whenever there's an infection, it takes longer to get cured. The treatment takes longer duration because the immunity is not good enough. Secondly, the virus will start thriving for a longer period because there is the increased sugars in the body. So the virus will multiply more and more and stays in the body for a longer duration. Another thing is, a diabetic patient may not show up the classical symptoms. Even for that matter, fever may not be very high in a diabetic patient whenever there's a serious infection. However, as I told you, the infection treatment will take a longer duration, and these are the ones who end up with having a severe infection because treatment doesn't happen in a short period. Treatment doesn't respond. People don't respond to the treatment in a quick time. So what is important to avoid this is make sure that your sugars are under control. Follow the usual things, that is wearing the mask, maintaining social distancing, using the sanitizer. Apart from that, another important thing that you need to do is get vaccinated. Irrespective of what vaccine it is, Covishield or Covaxin, both are equally good, hardly any difference between the two vaccines. So whenever you've got your slot, just ensure that you take your vaccine. It is not a contraindication. All diabetics can safely go ahead and take the COVID vaccine. Thank you.